Hi there, are you somebody whose back is always giving you trouble? Maybe it's something that comes and goes, or maybe it's chronic, and you're just looking for tips to make sure you don't hurt yourself more? Well, if so, then this video is for you. Hi there, my name is Morgan Ryston, and I'm the creator of Center Studio, where I teach people skills to feel more comfortable more often. Now, before we get started, friend, if you haven't already, be sure to hit the subscribe button, also that notification bell. That way, anytime I make a video like this, you'll know. Now, today's video, I wanted to look at one of the very common mistakes that people make that they don't even realize, oh, this could be hurting my back. This could be continuing whatever problem I already have, and maybe even making it worse. So we'll take a look at that now. Now, oftentimes for any student who has lower, middle, or upper back problems, I often like to look at how are they reaching for things in front of them. That could be they're at their dining room table, that they're at their workstation, that they're at a coffee table. How do they reach for things in front of them? And what I often see individuals doing is moving from this sort of imaginary waist area. So they kind of take their arm forward, they're reaching for something, and yet they bend here at their waist, which scrunches their spine, and you can see how it could contribute to the back discomfort that many people experience. Now, what we would do instead is move from the weight-bearing joint, okay? So we have a weight-bearing joint at our hips, and if you don't know where your hips are, I always tell students take your two hands and then put them all the way down on either side of your zipper, and you kind of want to move your legs a little bit to familiarize yourself with where exactly is that joint, right? And if you've had hip pain, you definitely know, but for a lot of people, I feel like that's sort of a novel idea because most people assume hips are out. Hips are to either side. Now that is a bone, but it's not a joint. So you have what people call in layman terms, a hip bone. This is your pelvic girdle, but your actual hip joint and where your body is intended to weight bear is actually here closer towards your center line of gravity. Okay, so that's at your hip joint. So that movement instead, say I'm reaching for something, would actually be like so. So my back doesn't even essentially change, right? Because I'm pivoting forward and my back stays nice and elongated, nice and erect upright, and yet I just shift the weight at my hips. Now, if it was further away from me and I had to move further, I wouldn't move like this and then employ the use of that imaginary waist. I would instead, if I get to a point where I can't move anymore, friend, I would just get up. I would use my whole body in that activity to accommodate the mechanics of the way that my body is intended to move versus starting to use areas of my body that are not really supposed to be bearing the weight of my whole torso, the top of my head, because that's a lot of pressure. And if you're somebody who has back problems, you can see how repetitively doing that over time can be really problematic. So hopefully you can kind of think about where do I move from when I'm reaching for something in front of me. Hopefully you found today's video helpful and you'll start to think about where are you moving from, really getting rid of that idea of the imaginary waist and thinking about the mechanics of your body. Where could I be moving from that is not going to be hurting my back? Hopefully you'll give it a try and you'll start to see some results. Until next time, if you haven't, be sure to like, share, and subscribe. Until then, take care. Ciao.